Okay, welcome everyone, and this is the EMSC for Children Innovation and Improvement Center, the EIIC. This is an informal office hour, and we are kicking off with this office hour, our PMHCA Quality Improvement Collaborative NTA. Today is February 1st, 2024, and myself, Anna Goldman, and my colleague, Jen Donathan, will be co-leading this I don't know what we call it, a class, an office hour. Jen, we can move on. Our agenda, we will try to convince you that any project is a QI project, where there is very simple example of how to get started. And why do we develop a project of scope and a project aim? Why is this important? Part of the communication technique and part of getting us started on any project, including the ED expansion project. We will walk through the PMHCA exemplar and working together on creating some of the aims and looking into how to put the project scope into place. And we'll also discuss some of the project paths we've thinking some of the groups might be interested to get connected to and get started working on as it relates to your ED expansion project. Lots of words of projects here. And then we'll discuss a collaborative plan next. All right, so here's the heads up. During our February 22nd, our goals are, so everyone is aware, we would like to clearly define your ED expansion goals. I would like to continue, if you haven't already, but reintroduce the QI introduction guide that was shared probably this week or end of last week. We will for sure attach to this when we follow up with this after today's presentation. We will attach the guide as well to kind of have that at the fingertips at all times. And then we will, at the 22nd, we will develop a global and a SMART aim. And today we will talk about those a lot more. And we will suggest a project path for your team as well. But again, very open and very informal and open to suggestions, and looking forward for all those best evidence that's already out there and with our different teams. All right, and I believe Jen was going to go next.
Sure. This is going to look familiar if you've attended any of our orientations, but just really wanting to hammer home that, answering the question, can any project really be quality improvement? And again, it really goes back to answering the question, so you want to make a change, what do you do? And so I used this example the last time we presented was, it's a new year, you want to have a new you. There's a whole host of different changes that you want to make in your life. And they can be really daunting. You have a lot of different goals and aspirations. So where do you start? So I gave an example of, I want to read more books in the new year. That's really noble. It's also very broad. It's not very specific to how many books I want to read, by when, how much, what kinds of books, etc. Fun stat, again, in the US, only 9% of individuals who make resolutions actually complete them. And more fun, 23% quit after the first week, and then 43% quit by the end of January altogether. So case in point, goals are great, but if you don't, well, one, have an accountability system, but two, really define what it is you're trying to achieve, it's really hard to actually make the change you're seeking. So again, what does this all mean? I've mentioned making things, specific, measurable. This is where we really want to define our goals in a smart way. We need data. We need to be able to track exactly what it is we're trying to measure ourselves up against. So if I'm saying I want to read more books, well, how many books did I read the year prior? Is it 0? Is it 5? Am I looking to contribute 5 more? So we have to have a good baseline to know where we're starting and really to measure against to see if we made a change. And most importantly, we need a plan. We need something written down. We need something outlined as to how we're going to achieve these desired change efforts. So really, it's creating a plan for progress. And this is where we are hoping to impart the wisdom of quality improvement on your projects very much like you would to any kind of goal you're looking to achieve. So going from something that's very broad and auspicious of I want to read more books in the new year to something that's really specific. So establishing, your global aim. What is your vision for what you want to achieve with your project work? For me, I want to read more books in 2024. That's great. That's your global aim. That's broadly what you're trying to do. But we want to whittle that down and really help define what it is in your work plan that's really specific, really pull out those specific change areas that you can set up a SMART aim to. So in the example of reading more books, by December 31st of 2024, I will have read 30 books. It's very specific. It's specific. It has measurement attached to it. I would say it's reasonably achievable. Gosh, I hope so. I would say it's also time bound. I'm giving myself the year to do this. So trying to meet each one of these markers within that SMART acronym really sets us up for success to really set a measurable kind of goal. And then with every SMART aim that you create, it's really having a plan of execution. So trying to create something that is realistic for your team as you're looking at your project work over the next several months. What is achievable to achieve your end goal, and setting that out, week after week, month after month. And then also ensuring success. So you have evaluative measures that you have to meet. Also, you have other team members that you're accountable to. You have your project officers you're accountable to. For me, in the case of books, it's my husband. So having an accountability buddy and check in with me monthly. So again, this is a really silly example, but again, it really sets the framework for what we're trying to do with this quality improvement work. And then we're all happy as a result.
And I like the husband as a good one. You can always reach out to me. I'll help you achieve that goal.
I love it.
Do we want to pause and see if folks have questions at this point?
I'd love to hear if there was nobody who's been on any of our previous calls, feel free to unmute yourselves. Is anyone not familiar with quality improvement, as the science? Or you can put it in the chat. You don't have to unmute. All right. Well, good.
All right.
We have a baseline.
Yeah. Okay. So this is where I thought I was talking, right? So this is an example of how one PMHCA team, and we took out some of the identifying information, but an idea that they had on how they would go about creating a SMART, specific, measurable, achievable, realistic, and time-bound aim. And this illustrates actually two things. You see here the SMART aim that has a percentage. For example, this is how we know we're succeeding or not succeeding. It has a date, and it has a particular institution, a hospital here, which we didn't identify, but they did. And it has the what, right? The suicide screenings. So it has all the elements in there. That's one of the examples. How we went to help the group identify the global aim is actually the project that they submitted to HRSA, the expansion project. It's a summary of that. So that is what is one can do when you create a global aim. So decrease the rate of child suicide in such and such county was their overall /global aim. So this is just one example that we wanted to demonstrate how in PMHCA world this could be achievable. So I'm going to pause here just for a second, then we'll play. We have an example we'll share and work through how to create a SMART aim or global aim. All right, let's go to play. All right. So now we're going to include you guys, so you can't get quiet anymore. So do you have in mind or remember or heard that others done an aim or a project idea you submitted for ED expansion? Like, it doesn't have to be yours, can be in other teams. Well, I see, let's see, don't we have Jody on here? Jody, give us an example of a project the team submitted in one sentence.
Okay. Oh my gosh, I'm trying to think.
Simple, doesn't have to be, too complicated. Like what people wanted to do, how did they want to expand to ED?
Okay. Wanted to train more ED professionals on pediatric mental health.
Great, perfect. So that is our global aim. So that would be our global aim statement. Jen, are you able to type?
Actually, Han, let me get out of the share.
Yeah, we were gonna type in and then share it out together. Okay, so let's start thinking from what Jordy said, and we put it in the chat. And we're gonna go around the room and see how can we make this goal now a SMART goal. I'll let Jen put that in the slide so you guys can have that in front of us.
Let's think of it in terms of, say, like a broad general goal. So you know that a team is doing this, and this team is your thinking, like, how would you define this in a smart way?
So let's start with specific, who and what. You guys yell out the answers, looking at this global aim.
We might want to identify who those ED professionals are, their credentials, for example, nurses, MDs, DOs.
Mm-hmm. Yep, there are nurses, there are social workers in the ED. There, yes, absolutely, doctors, MDs, DOs. And why do you think, why do we think that's important, that credential on piece?
Because if we want to train them, we can identify the baseline knowledge for them as well. Maybe residents we can include as well.
Right, different scope of practice each has, different knowledge baseline, different educational preparation. All those things are important. Yes, absolutely. Because you're going to create very different education in the way of how you're approaching it. And if you are planning to provide any continuing education hours, this will also be, helpful as well. Yeah. Anybody else? So who and what for our goal? So what is going to be probably our topic, right? What are we gonna?
Right. Yeah, I was gonna say that, like, what specific topics they need to be trained on.
Yes.
Yeah, what gaps are there in the ED that we need to close or tap into.
Yep. Very good. All right.
I think that's pretty good for the who and what.
Okay. Now measurable, by how much? How are we going to measure what we trained on? Are we going to count the number of people?
Would it be hours and for CEs?
Hours, yeah, could be, yeah. CEs, yeah. What else can we? Survey through the survey assessments we have, somebody saying, yes.
Determine how what training, how do you quantify that? How many training is enough training? Are we looking at 3, 4, 6? Are we looking at a year's worth of training? Yeah, like just that way we're not just, it's just easier to quantify if we do 6 trainings covering 6 topics, by the end of which we will have achieved, you know, whatever those, whatever topics we are hoping that they get trained on, so.
Yeah.
Maybe the number of people trained as well.
Okay, that could be measured. Oh, I love it.
How many providers we're trying to train.
Number of trainees. Yeah, we have it in there. Yeah, the second one down. Or were you looking at the particular providers like social workers, MDs, DOs?
If we can do it more specifically, I think it's even better, right? It's more
Absolutely. Yeah. Yeah.
more smart approach.
Yeah. Yeah. Absolutely.
I think going back to this one too, like the type of training and how much is enough. Like, do you want to have some kind of evaluation component attached to it? Do you do a pre and post? Is it just after?
Yeah. Yeah.
Right.
So this is how we can measure. So we might need like, as you said, pre and post a baseline and after, see if there's an improvement in knowledge or comfort in using some, you know, assessment tool, whatever it is that we're trying to achieve with that education.
I wonder if there is a way to measure how much of the training they apply in their practice, if that's in any way.
You know what? I actually lead a team in my hospital, and so we had Project Echo for our pediatricians, and what was suggested is that after the several trainings on I think psychotropic medications, we wanted to evaluate and actually pull the information, which I think is still in progress because it's a big project, to see if their confidence in prescribing medications were, you know, increased after this training, and they actually started to prescribe more medications. So there are other ways how to use measures to see if actual application had taken place and implementation, like an outcome measure.
Like an outcome.
And we can probably talk about there's lots of different measures, but I don't think we're ready for that just yet at this presentation. But these are great suggestions. All right, so how do we then, Jen? Well, let me stop here. Any other measures? How can we measure our specific aim here? Anything we missed that folks thinks that we can add? Are we ready to go to attainable? How will we do this? Or how will I do this? Usually it's a group of us, thank God. How will I do this?
Yeah. What considerations do you need to make in order to achieve your goal?
Yep.
Think time, think staff, think resources.
Well, I guess in regards of resources, it has to be evidence-based and supported by, you know, various data and such.
So we will research, we will do the research and make sure that education we provided is evidence-based. Is that what, Gabriella, you're thinking? Okay.
Yes.
I think budgeting is a big part. So recurring recruitment for faculty, we will have to see if that's attainable. How many sessions we want to do, and how many faculty sessions, how many hours for that as well.
Right. So create that structure around the structure. Like if this is so many hours a month or so many hours a year, or how many, yeah. Who will be teaching it? How will they be teaching it? Is it a Zoom format? Will we be providing continuing education, right? It's another consideration. Who will be doing that? That's a whole different story.
How would we promote the program for enrollment?
Yes, huge one. Mhm. Yep.
Yeah, that's a good one. It's a great idea until no one shows up for it.
Right. So that's why that survey is so important. In the beginning is one of the questions is for them is to, hey, is the lunch hours better, or do we do something video something and give it to you? What do you want to read? Just something. What works better in your environment? Yeah, important things. All right, I think we got enough for Tenable, yeah? Or do we need more? How does the
Gabby, were you
group
going to
feel?
say something?
I'm thinking on faculty evaluation as well. Having some feedback from the participants and see how we're doing, if we need to adjust or we're doing just fine.
Mhm. Yeah, we forgot about that one. That's for measure, yeah. Feedback on faculty, whoever's teaching, yeah.
Yeah, that's a great one. You don't know what you don't know. This is looking pretty robust. Good.
All right, are we ready to relevant? Why does this matter?
How do we
We will
know
save
better?
more lives, hopefully.
Yes.
We'll prevent physician burnout, the ED space.
Yeah, how about we improve access to care? Right, maybe speed up that through
Mhm.
process for EDs, and we give them the resources or toolkits to use and make it available to them via knowledge. Mhm. Oh, somebody said timely delivery of care. Yes,
Mhm.
very good one.
I don't know if this would be considered as relevant, but or I can't speak today.
None of us. You're good. You're good
But
company.
I was thinking in training the various ED professionals, it also in a way forms a bridge between behavioral health departments, and it branches out. So, and not just ED, but it goes throughout the hospital as well.
Yeah. And also outpatient, right? Your pediatricians in the community could be beneficial for them as well to have that bridge between the two. Mhm.
We might be able also to expand parent education within the ED setting. If we expand education within our providers, there's also an opportunity to say, for instance, if we're implementing safety A, and then across the board, maybe we have an opportunity for parent education as well to prevent
Mhm.
risk in the future.
Good one.
No, that's really good. And I think that really speaks to in part of keeping relevancy is you're building those relationships with EDs, always keeping them in the loop on the process of your work. So like making them feel really a part of the efforts that you're putting out. So you can always solicit that feedback in real time. I think that also goes back to, again, the very beginning. If you don't get a really solid understanding of what it is an emergency department needs or wants, you know, again, the best laid efforts are only go so far as it mattering to the EDs as well. Yeah. All right. I think that's pretty good for relevance. Let's move to time bound.
Yeah.
So what would help make this goal a little bit more like within the confines of time and space?
This is a good one because to think probably through the previous ones and think what's possible. What's our theory of what's possible? It's probably going to be based on what we just priorly said, right? So how do we make it possible and achievable by this point of time? It's good to have, though. It's always kind of keeps you in the in that focus mood. So time bound. Oh yeah, somebody said short term, midterm, long term. Yeah, we can identify those. Yeah, something we'll achieve very quick. Something will like a little milestones. That's a good one. That's a good ones to look at. Yep. We'll do some chunk it up. We'll do a chunk of it by such time and chunk of it by such time, and we'll end by such time.
Maybe another consideration is the time that will take from learning to application. What's reasonable?
Mm-hmm. And Gabby, you mean here your learning gap or provider's learning gap?
I'm thinking about the provider is like the providers. So
The ED provider gap?
Yeah.
Okay.
yes. So how long does it take for them to learn, say, the program? How long is the program? And how long does it take for them to implement it so we can collect data and see if we attain the big goal of like implementation?
That's a good one to think.
Something that may be experienced, across the board, but specifically for us out here in the Pacific, we have to include the window of time that it takes to just complete the research portion, procurement portion, contract portion, and then determining time zones for our providers because we are on the opposite end of I guess the time zone. So just being fully, just making sure to include that so that we're not just talking about implementation to implementation to application of the training. It's everything before it. And that's one of the things that I speak from current experience. That's one of our biggest setbacks right now is that what we would like to take 6 months to implement, and on paper it looks fabulous, it takes about 1.5 years. So being realistic, that training is going to be stretched just because of that kind of where we are and how we tap into those evidence-based resources. So yeah.
That's a good one. That's a good one. So it's even prior time before you implement, it's that time of logistics time. Sounds like, yeah, before.
I think it'll just help make things a little more realistic because kind of like with the global aim of reading books, it's easy to get discouraged and discouraged when we're not meeting certain goals, especially when we have those milestones in place. But it's important to just, if we're mindful of what those delays are going to be, then we will stay the course. It's easier to stay the course as opposed to not considering those challenges.
Oh yeah. So that makes it more really like realistic, to allow yourself that time. Yeah. It's every time, and this reminds me, every time I think when there's a new task given or a new opportunity, I call it, to learn something. And then the ask is to deliver it tomorrow. I come back and say, I need time. I need time to research and learn it first. So you failed me in the first you set me up for failure to begin with because I need time to learn. So it's important to remind people who make decisions, okay, give it a time. And moreover, it'll be helpful you provide me with a toolbox where I can go and learn about this. So this is a good point. And then Jen, we also have in the chat Miriam, I think there was a comment about evidence-based, and I think I've lost that. If there's an
I put a
evidence.
comment back to it.
Okay.
I think
Miriam,
that's,
go ahead.
I think that's a good point. I hope I addressed that right. If you meant something differently though,
No,
Miriam.
you addressed it, Jen. Yeah,
Okay.
that is, and I see that you added that set up timeframes that are supported by evidence.
Yeah. Finding the evidence is another timeline. Okay, I digress. Okay, so Jen, what do we think about Smarty? Do we now have all the guidance we need?
I think so. So let's do, and this can be a little simpler. We don't have to use every little bit of this, but let's go and let's just create based out of like our whole bank of options here. Let's create a more smart aim from training more ED professionals on pediatric mental health. So what would make that aim smart?
We're gonna have to pretend like we know the answers to the things we put out, right? Like under specific, who and what, we're gonna, put in hypothesis and say anybody. Let's pretend who we gonna educate. Who do we want to educate? Let's start there. Nurses. Okay, that's right. So we decided nurses. What are we going to train them on? Topic. Yeah, Jack is going to say nurses. Okay. That's a good one because nurses and social workers are often the ones who are screening the patients. The first ones in the ED to see the patient, actually. All right. So let's come up with a topic, guys. It doesn't have to be perfect. Free for all. Screening tools. Okay. How about A1 screening tool? Which one do we have? Oh, somebody said trauma. Okay. I like that.
Thank you.
ASQ. All right.
Oh, I like that. Okay.
Yeah.
Yep. On the ASQ. And let me make this even more specific. So we will train ED nurses. Wow, I'm backwards today. We will train ED nurses on the ASQ. How about over the course of how long?
Yeah.
2 months, 4 months, 6 months? Okay.
6 months, Jackie. All right.
So let's think, make it more specific and add a measurement to it. Training ED nurses. How do we want to measure that? Like how many nurses attend, percentage of nurses that maybe you pull at the end and give you feedback. How would you like to define that? Like what would be a good measurement in this?
Is it measuring the tool, ASQ?
Ooh,
We're
there you go.
teaching-
Yeah.
How many nurses want to receive CE? Oh, that could be in addition to.
So keep dropping things in the chat. It'll help me kind of create something.
Yeah. 60% of nurses working in the ED in this hospital. Including night shift. I love it. So we could actually define by shift or, you know, by percentage as well.
I like it. So that's moving towards a much smarter aim. So taking broad of doing more training to over a 6-month period, 60% of nurses in my ED or whichever partnering ED you're working with, and you're considering in your N as both day and night shift nurses, 60% of those nurses will be trained on the ASQ or receive training. How about that? We'll receive training on the ASQ. Or do you want 60% of them to complete the training?
Oh, that's a good identifier, right? Complete is probably a more defined, right? Complete.
Yes, can we say what the purpose is? Ooh, sure.
All right.
Yeah, the more specific, the better. Yep. So that's great. If you have 100 ED nurses between both shifts, you're aiming that at least 60% of them will have completed that training, all contributing to your goal of creating a safety plan. I like it.
And we can actually measure by reviewing charting documentation, right? One way we can assure that this was done. We can see how many patients received this screening by whether or not this was documented. Another way is the nurse's confidence. We can give them a survey and measure their confidence of using the tool before and after. It's another way of measuring our success. Any other ideas? As far as
Will you
measuring
share
goes.
these beautiful slides after?
What was that?
Will you share these beautiful working slides after?
Yes,
Sure.
absolutely. It is the purpose of the whole thing today. Yeah.
No, but this is great. And again, like it feels tedious. And again, all of you submitted work plans that are obviously tied to your measures, or they contribute to the programmatic measures, but this can really help you kind of single in on, like you could have very broad scopes, or you're trying to do a lot, and this can really help kind of fine tune those specific areas of focus for you and really try to pull out, okay, so what am I tackling first? Because a big component of this too is really to measure the impact that you're having. And again, I know that, you know, again, not to say that you haven't already created measures, but this could be a way to help fine tune those measures and maybe make them a little bit more, I'm trying to think, either more robust, or maybe if you were struggling on determining like what your measure would be for a certain thing, this kind of exercise will help you really think through, you know, like there are so many different ways that you could have looked at this, at evaluating, you know, the impact of your program. Because you could have the impact, like you could define impact by the number of trainings you hosted. You could define the impact by how many people like actually came to them. You could define impact, you know, if you go a step further to see like, did they actually apply the tool? So those are just kind of like the different levels of consideration as you're thinking about overall measurement with your efforts. There's so many different ways you can slice it.
And also, just to piggyback on this, remember those things we talked about, not to overwhelm yourself, is the milestones, right? So for each milestone, you may have a smart aim, right? So it's how do we eat an elephant? one bite at a time. So that's helps to chunk it up, but in smaller chunks of work and milestones. Okay, well, Jen, we are at the good timing. We have 10 minutes left, but we will, you tell us if you like the smart aim that we created. I think this team done an outstanding job.
No, this is great. And again, like any project plan, like that's the beauty of this. You're going to learn more as you go, and your smart aim can evolve. It's not a static thing.
Yeah.
So again, you might make this thing more robust. You might alter your focus on, 60% of nurses. You may like, no, I want more. I think we can achieve 75%. So this thing is not static. It is evergreen. It is living and breathing. So I do want to jump to project scope since it is tied. Like, again, in your work plans, you've probably already outlined things like that. These are in the slides for your consideration, but I think that this hammers on what Anna was saying too, is that as you're thinking about setting milestones and who's on your project, kind of assessing your team's own like internal capacities to handle the work, really creating that project scope for your team to really anchor into as its true north. And it's really, I think, pulling out from your work plan and really simplifying it even more so of like, what's your objective for like, and you can create a charter for like each aspect of like the project work that you're doing. Like, what are the specific objectives, deliverables, and scope, like as you're going through your project journey? So we have those outlined here that we can share with you.
Yep. And this is a good exercise to go through with a team together. The form for the project scope, the guidance of the work was attached to the introduction guide. Please use that, as well as anything we talked about today, the SMART aim, the project scope. Email me, we'll set up a time one-on-one with your team, and we'll go through with it with you on every and single thing together. So it's not like you guys are there by yourselves, not at all. All right, I think we are at the time now, Jen, to jump in our next topic.
Sure. So I want to preface like the next portions of this. So I know that some folks on the call are participating in our quality improvement collaborative. So that session that Anna mentioned, the 22nd, it is open to really anybody who wants to listen and learn. But for those who have said, hey, I'd like to take it a step further and really try to apply these QI principles to the project work that we're doing, on the February 22nd meeting, we're going to do more of this kind of work and really try to hammer in on defining that SMART aim, and ultimately build out your project plan through like kind of a quality improvement lens. For organization purposes, since we know that teams are, they vary in the kinds of project work they're doing with their ED expansion efforts. The way that we've kind of boiled down all of the efforts to the best of our ability is that we've kind of bucketed them into like 3 different pathways. And so it could fall like we've identified teams doing, education and training efforts for providers. So when we say this, these are really provider specific efforts. Like, are these trainings that you're offering, ED nurses? Are they, educational modules that you're offering to physicians, social workers, et cetera? Again, this is very provider specific, offering them the tools and education they need to enhance what they're offering. We also have teleconsultation path. Again, provider to provider, these are the teleconsultative services that you're offering. Like a provider can call in and ask questions of your team. Consultations can look like guidance on screening, specific screening preferences for pediatric patients, medication management questions, maybe any guidance on discharge and safety planning. Again, kind of that telephonic or telehealth model of offering consultation services to ED providers. And then the final one, the best way to sum this one up is like community resource connection. So going beyond the 4 walls of the hospital, a lot of feedback that we received from emergency departments was that again, there's many areas that they struggle with, but we found a common theme of really what happens to the patient when they're getting ready to leave the emergency department, and how do we ensure that patient doesn't come back, and that they're connected to a resource out in the community. So we've kind of defined this bucket as like a community resource connection path. This can look like providing guidance on resources to connect patients to within the community, maybe utilizing different processes such as telehealth platforms, maybe other technologies to help connect patients to providers or places. I know one team has set up a virtual hub of sorts where they get on the call and they have providers from across the state really looking for beds for patients. We would kind of lump that under a resource connection kind of model. And then all the way up to, I know not a lot of programs are doing this, but I know some programs have talked about what would it look like to offer actual telepsychiatry to a patient. This is kind of our grab bag of kind of that third path. Also knowing that while we have these 3 different pathways and it helps us just stay a little bit more organized, we understand that teams could be dabbling in one, if not all of these, in their ED expansion efforts. Why we've done this is that over the course of our collaborative, we're going to pinpoint smart aims for teams. But then once teams have kind of honed in on the specific area of work that they're looking to apply quality improvement to, we want to break out into groups and try to pair like teams with like teams. So if we know that there are teams doing, teleconsultation, we want to pair you all together so you can all brainstorm together on the best solutions. Again, understanding that you all have your own, your nuances state by state, but it'd be really nice to put you in a room with other people who are, maybe working through the same challenges that you are. So that's our ultimate goal of why our kind of general pathway descriptions. It was our best attempt at trying to separate groups.
Yes, Jen, thank you. This was a great description there. Just wanted to piggyback a little bit more on this idea. We also have a number of new teams joining our efforts, and thank goodness for that, who are just thinking to apply for funds for ED expansion. So they really are learning, and the 3 pathways that we are creating that Jen described here are basically for anyone who wants to listen in. So if you're in a position where you are just learning and kind of, out of the curtain peeking and seeing what's out there, you might want to join all 3 teams, just kind of learn about what's happening as well. So there's not a hard rule for any of that. And another cool thing I wanted to add it to plug in for the 22nd. What's cool about, I think, our collaborative, even more so, we have 5 teams who have done some of the work, QI work, actually, with smart aims and developing their project scopes and their key driver diagrams that they would share with teams who are just starting. So it's a great opportunity to network and collaborate with others who might be in the game for a little bit longer.
Thanks, Anna.
Sure. We have 5 minutes left. Are there any questions, talking points, suggestions you guys wanted to touch on? All right, people are being quiet, probably either not awake or almost asleep.
I have a question, but it's more related
Yes,
to what is it called? The HIA education program that you have on your website and links to like the OI school.
The Institute for Healthcare Improvement, IHI.
The open school.
Mm-hmm.
Open school. Yes.
Mm-hmm. Yeah.
Is it okay if I ask that question in this space, or should I do it
Yeah.
in another space? Yeah. I'm wondering what are the requirements to enroll. They have like an overall program for becoming QI specialist, and my educational background, my training is not in healthcare. It's not a clinician, but I've worked in QI projects, and now I'm part of the efforts through Duke University in this space and CPL. So I wonder that program is available for non-healthcare or clinicians professionals.
That's a good question. I don't know. And don't know. Jen, do you know?
I believe so. I'm not a clinician either. I have a public health background, and I believe, and I'd have to double check. I have to go back to their website and see, but I believe the open school is open access to anybody who's interested. Now, if you want to go through like specific kinds of training, then you'd have to like enroll probably in a paid program. But I'd have to double check. I'm pretty sure the open school though is free to just piece through just their curriculum. But if you're looking for an actual certification, you'd have to,
Yeah,
you'd
there are
have to-
requirements that there is a payment, and I'm not sure if credentials, I don't know, guys. I know I've got through with my certification through my hospital where I work, so that I would not know.
No,
Mary
okay.
had a question.
Yeah, so I wanted to know for other sessions that are held, if you focus within the realm of quality improvement, but more around tracking and analysis of our data. I'm a PMHCA awardee, and we're going into our third year. And our data from our year one to now has significantly increased. So we were primarily functioning off of Excel. So I was just curious if you do offer sessions that promote different platforms that other programs have administered, just in terms of quality improvement in achieving your SMART goals, but also just program expansion. And if not, if you're aware of any resources around that realm.
Miriam, is the program you're talking about ED expansion project or overall PMHCA program?
Overall PMHCA program.
We did have office hours last year that focused on a little bit on tracking of data and working with Excel. And now I'm gonna punt it to Jen. I don't think we will have something like this year.
Okay.
Well, sorry, I was responding to a question in the chat. Are you asking about specifics around data analysis?
Yep. Yeah, just different platforms that different awardees have used.
Yeah, different platforms. She's asking if there's if we're gonna provide ideas how to track platforms available, anything like that, like more expanding on this. Did I get it, Miriam? Did I say it right?
Yes. Yeah.
Yeah, so the EIC has, so as a broader reference, we have our telehealth toolkit, which offers some guidance on different technological platforms. I think we can maybe resurrect some of our recordings from last year that talked specifically about some technologies. Miriam, if you don't mind, maybe follow up via email with maybe some specifics, and if there's an individual on our team that we can connect you with.
Okay.
We do have data analysts available to us, but again, when there's not a specific, like if there's a specific, like you want a different names of platforms, many beneficiary, what's beneficiary, what's less beneficiary, if that's the question that we can address specifically with our data analyst. Please just email Anna Goldman. That's I'm like my email like all over the all over the place. So, but I can connect you with people who can help.
Okay.
Here you go. Yeah, Jen just dropped my email in the chat box. Thank you, Jen.
Thank you. Thank you both.
Sure. Yeah. Our pleasure. All right, I'm going to start recording because this is 5:31, but we can linger a little bit